Well, welcome everyone to our first webinar of 2021. We're so excited that we're going to start doing some monthly webinars with you. And the first topic here is ketamine. So I'd like to introduce Dr. Allison Mulcahy, who hails from Idaho right now. And we so appreciate her calling in. She's our supervising physician, has experience using ketamine from not only the emergency room, surgical, but also wellness and regenerative perspective, which we're going to learn a lot more about today. We're very excited to have her experience. And if you want to share any more about your background too, you're more than welcome. Otherwise, we have a lot of staff members and a lot of patients listening in today, and welcome all of you to send any questions you have to carol@joywellnesspartners.com, and we will have time for questions at the end.
Awesome. Thanks, Carol. Are we going to have the chat box open as well or no?
Yeah, chats are available too. You can chat
Okay.
in a question too, and I'll read those. And that's another easier way too for people to ask questions.
Great. Okay, well, let's get started. And I want to make sure we get through everything on the ketamine today, and we can answer any questions at the end. I do, as Carol was saying, I do have a lot of experience with ketamine working in acute care settings in the emergency department, and then also now working with more chronic pain and depression patients in the clinic setting. So very excited about it and excited to share some of the information about ketamine with you all. So first thing, I want this to be a little interactive. When you hear the word ketamine, what is the first thing you think of? So I want you to just put it in the chat box, and we're going to come back to this later. And we'll see what I'm going to do is see what you've learned throughout this talk at the end. Okay, what we're going to talk about is the indications for ketamine, the history of ketamine, how ketamine works, the pharmacokinetics of ketamine, which probably sounds scary to a lot of people. Don't worry, I'm not going to talk about that for too long. I'm going to talk a lot about what it's going to be like to experience the drip, and then talk a little bit about stellate ganglion block and ketamine synergy. We're going to talk about contraindications and safety, and then we'll leave some time for questions. So ketamine has a whole wide variety of uses, and I think what we're most interested in from the Joy Wellness Center perspective is depression, PTSD, mental illness uses. And over the last century, we really have not had too many great options for mental illness. In fact, it's been one of those conditions that we really haven't had a great tool for. And even medications like SSRIs are barely better than placebo in trials. So stellate ganglion blocks, as probably many of you know, have been showing incredible promise. We've been having a lot of success with patients with PTSD. And then adding ketamine, I think, is also, it's the newest, most promising drug for all these mental illness conditions. And the interesting thing is that's not what it was initially designed for, which is oftentimes what happens in medicine. There's no better time than now to talk about this because of COVID. So probably everyone is aware of someone in their life who's been really struggling this year. And depression has tripled across all demographic groups this year. We've just seen increases across everyone. Everyone's pretty much been being hit. We know that people who are poor are 2.4 times more likely to be hit. And this was already before COVID a problem. It was a national epidemic with depression that over a quarter of people suffered from depression. So add COVID onto that, and it's a real national health crisis that we really don't have a lot of tools for. So ketamine is really exciting. Ketamine's actually been around for quite a while. So probably a lot of you have heard of PCP. Back in 1956, Dr. Harold Maddox synthesized what became as PCP. And as probably maybe some of you have even experienced PCP, causes lots of hallucinations, delirium, all sorts of side effects. And so they started looking for a different drug, and ultimately in 1964 came up with ketamine. And then in 1965, they actually removed PCP from the market because of all these side effects. In 1966, that's when ketamine was first patented. And it was initially patented under the name Ketalar, and it was patented as an anesthetic initially. Ketamine has been FDA approved since 1970. However, in the 1970s, it started to be a problem because it became used quite frequently as a recreational psychedelic. And so a little bit later in 1999, it actually was banned because of the abuse, and it's only used for it's only used now for medical purposes, and it's a Schedule III drug, which means a practitioner who has a DEA license able to prescribe Schedule III drugs has to be involved in order to use ketamine. As of now, it's still just FDA approved as an anesthetic. We also have a nasal version of ketamine, which is called Spravato, and that is FDA approved for treatment of resistant depression as well. And then there's a ton of off-label uses for pain and the previous uses that I discussed a few slides ago. So how the heck does ketamine work? So this might get a little bit heavy for some people if you're not into the science, but bear with me here. It's kind of interesting. So all throughout our body, we have neurotransmitters that signal messages to our body. And the glutamatergic system is the main excitatory neurotransmitter system in the body. And so glutamate binds these little channels, and then sodium goes through and it sends messages. And so when we're sending too much sodium through, it's going to send messages like pain, pain, pain. And this becomes helpful because by blocking this, we'll see in the next slide, what happens with ketamine is ketamine actually comes in here and blocks the glutamatergic system and keeps all this glutamate, all the red dots are glutamate, it keeps all the glutamate in circulation before going through these receptors. There's two different types of receptors here. There's the NMDA receptors and the AMPA receptors. There's actually lots of other receptors as well. But for the purpose of describing here what's going on, what we want to do is prevent those signals that are saying pain from going, but we want to keep the signals that are going to signal for us to grow more nerves, for example. So the way that we think that ketamine helps from an antidepressant standpoint is that it actually allows these certain receptors to have increased supply of the glutamate going through, and then it basically increases a few signaling pathways, including brain-derived neurotrophic factor and the mammalian target of rapamycin, which is called the mTOR system. And both of those systems are very important in terms of health and wellness. And particularly, we've noticed that if those systems are upregulated, we see less depression. So this is kind of how ketamine works for both pain and depression. A little bit more on how it works with those receptors. So we have all sorts of receptors. Probably most people have heard of opioid receptors, heard of the opioid epidemic, but they work, there's all sorts of different type of NMDA receptors throughout our nervous system, and ketamine works on all of them. And so it can help with people who, for example, have opioid addictions. It also modulates dopamine, serotonin, and norepinephrine, which are three of our very important happy and mood regulating hormones. I talked a little bit briefly before about the Spravato, which is the nasal form of ketamine. If you look in the upper right-hand corner of this slide, you can see that there's two different types of ketamine. There's the S and the R type. So the Spravato is the S type, and that type can be used for nasal spray. And that is FDA approved for resistant depression. However, the IV form tends to give us better results. And that's, if you look at this slide here, the reason is if you kind of look at the graph on the right, you can see that an IV form is going to be spread out more versus an IM form. And what we've noticed with intranasal forms is that there's just a very big variance in terms of people's responses. And so with IV, we can titrate it to exactly the perfect amount for each individual versus giving just one injection or a nasal spray. It's hard to know exactly where that perfect amount is. And if we look down below here where the little red dot there for depression, you can see that it's actually quite a very narrow window that's good for treating people with depression. If we do too much, it's not good. Too little is not good. And so with the IV, we can kind of titrate that to the perfect amount for each individual. So what's it going to be like? What's ketamine like? So if anyone out there listening has ever done psychedelics before, you'll have kind of an idea. Ketamine is a psychedelic. Unlike if anyone did psychedelics back in the 60s, though, this is going to be a very controlled experience. So we don't have to worry about you having a bad trip because we can titrate it to the perfect amount. People describe having much more of an open mind, an open heart. I've heard people talk about unicorns and rainbows, which is why I put that picture in there. I think it just helps you to sort of get out of the way of yourself. So our minds oftentimes come up with all sorts of ideas of why we're lesser than, why we can't heal, why we're never going to be better, why things are bad. We're kind of programmed to think of negativity, and ketamine kind of helps to unveil that negativity so that we can see the world as the beautiful place that it really is. So what does it look like actually for your experience? If you look at this picture here, you're going to be lying down. You'll have eye covers on if you'd like, or we can turn the lights out. You'll have headphones on potentially for music, or we can have a speaker on, and you will be connected to an IV. But as soon as the ketamine kind of gets into your system, you won't even notice the IV. It'll almost just feel like you're floating there in the middle of space. And the drip lasts about 40 minutes, and you'll have someone with you there the whole time. And we will titrate it to exactly what you want. So if you feel like you're starting to feel like maybe too many unicorns and rainbows, we can just titrate the drip down. If you feel like you're not having enough of an experience, we can titrate it up. So it's very nice, the control that we'll have. Generally speaking, in terms of the research on this, doing more drips is better than just doing one drip. And it seems like the sweet spot is doing 6 drips over a period of 3 weeks or so. They've looked at doing more drips. It doesn't seem like 8 drips for most people is much better than 6 drips. And they've also looked at doing them back to back. And it seems like, as long as it's done over 2 to 3 weeks, that's great. Doesn't have to be every day in a row or anything like that. Very interesting thing that I think we're offering at Joy Wellness Partners is the synergistic treatments of the stellate ganglion block and ketamine therapy. So as probably some of you know, the stellate ganglion block blocks the sympathetic nervous system and is kind of a sympathetic nervous system reboot. We're not going to spend a lot of time talking about that during this talk because this is on ketamine, but it is important because ketamine actually stimulates nerve growth of both the parasympathetic and sympathetic nerves. And the sympathetic nerves are our flight-fight nerves, so we don't really want to be increasing them. The reason all of us are alive right now is because our ancestors were really good at surviving those attacks with lions and tigers and avoiding any dangers. And so now, in 2021, we all look for dangers way more than we look for the good things. And so our sympathetic nervous systems are already on overdrive. So we really don't want to increase the sympathetic nervous system, but we do want to increase the parasympathetic nervous system. There's not a ton of ways to do that. Ketamine does do both. And then if we block the sympathetic nervous system at the same time, theoretically, we can be increasing the parasympathetic without increasing the sympathetic. The parasympathetic is the rest and digest nervous system. It's what's going to allow us to heal. If we're getting regenerative injections, we want our bodies to be in parasympathetic so that we can heal better. In general, we want to be in parasympathetic as much as possible during our days. It's also, probably some of you have heard of the term inflammaging. The more inflamed that we are, the faster that we age. And we notice that as we get older, we notice that, we don't recover as fast, and that's all from the inflammation. And so if we can stay out of that inflammatory sympathetic nervous system as much as possible and stay in the parasympathetic system, we're just going to heal better, we're going to feel better, and we're going to age slower. So ketamine seems pretty awesome. Seems like it would probably benefit most people. There are a few subsets of people that we have to be careful with. So I just wanted to go over that. Anyone who has a severe cardiac history, or basically anything where it's going to be dangerous if the blood pressure goes up too much, these are people who would kind of probably want to avoid ketamine with. Depending on the scenario, we could make exceptions to give ketamine, but also have blood pressure medicines there in case the blood pressure goes up too high. With ketamine, your heart rate will go up and your blood pressure will go up. And generally your respiration actually goes down. So cardiac conditions, we need to be a little bit cautious with. WPW is a certain cardiac condition. If you have it, you'll know. If you don't, it just has a chance of having a dangerous arrhythmia. And then we want to be careful with anyone that has a history of pretty severe mental illness, because it is a psychedelic and it can, in certain people, exacerbate paranoia, exacerbate hallucinations, things like that. So it's not to say that it's an absolute negative, but we want to be very mindful with people with these conditions. And then, of course, anyone with a history of abuse. A nice thing about ketamine is it's not like more is better. If you take too much ketamine, you actually become unconscious. And that's what has been used for many, many years in the operating room and emergency department for anesthesia. So for that reason, it has a much lower profile of abuse. It also doesn't last as long. So the drugs that tend to have more abuse profile last in the system for longer. Safety. So we're going to make sure when we're giving you these drips that we have all of the resuscitation equipment available, and the drips will be administered by people who are trained in resuscitation. Something to note, though, if you look up ketamine, you do a Google on it, when we use it in doses in the ER in the operating room, we're using much higher doses. And there is a small chance, it's even incredibly safe in those settings. There's always a small chance that people will have problems with their airway, which is why we have all these resuscitative equipment and training around. With the doses that we're using and the rate that we're doing the drip at, this is incredibly rare. But we, just like the little diagram says, safety never takes a holiday. So, and danger never takes a vacation. So we're taking all of the necessary steps to make sure that everyone is very safe. The main thing that happens that is quite common with ketamine is people get nausea and sometimes vomit after. And so anyone who has a history of migraines, anyone who has a history of motion sickness, gets nauseated easily, we'll just give you some nausea medicine up front, and that should take care of the problem. Okay, so now that we're at the end of going through everything, I'm curious if you could put in the chat box what the first thing you think about now when you think about ketamine. And then I'm curious if whoever's looking at the chat box, if there's anything to report here before and after. And if there's not, no worries. We'll keep going. So I think I just want to say that I'm grateful for ketamine. I'm grateful to have the opportunity to offer this service to more people and to hopefully help more people. And along with all these treatments that we're talking about, in terms of stellates and ketamine, it's super important for us to do our daily practice of just helping our brain to look for the positive. So gratitude practice is a great way to do that. Just think about things that you're grateful for, tell your friends, tell your family members about them. Our neurons that fire together, wire together. And so what that means is you can actually rebuild pathways to look at the world as a much more unicorn and rainbow place rather than seeing all the dangers everywhere. So that's it on ketamine. We'll do questions in a minute, but I just also want to say that we're going to be doing monthly topics. We'll do the microbiome next month, and then I would be curious to hear what else you would like to learn about. And so if you could put that in the chat box or send an email to Carol, that would be excellent. And then any questions?
Yeah, thank you so much. That was super informative and a very efficient time. So I will just summarize kind of the contrast of the chats as they've been coming through. Initially, there was some, words that were like concerning or fearful, like the horse tranquilizer and, questions. And then pretty much everybody just unanimously after your presentation just had the thought, helpful, helpful, helpful. So very cool to be shifted in our perspectives of it just from a short presentation. Thank you very much. We have some questions for you that came through.
Great.
We wanted to know, what is the success rate of ketamine?
Yeah, that's a good question. And success rate depends on what we're looking for. So, in terms of, are we looking for depression? Are we looking for chronic pain? And so I actually can't give you specific numbers. I don't know if that person is asking for a particular condition, but for depression and just kind of general overall improvement in mental illness symptoms, it's quite high. I don't have a number though. I can look that up and let you know.
Sure. Yeah, that's what I know too. More than 50%, like 70 to 85%. Yeah.
Yep.
What about the individuals with hypertension, high blood pressure?
Yeah, so for people who have high blood pressure or cardiac conditions, what we will do is put you on a monitor, and we will monitor your blood pressure throughout the drip. And so you might think like, oh, that's going to be distracting, but just like I was saying earlier with the IV, you don't really notice that the IV is in there. Same thing with the blood pressure cuff. You probably won't notice it too much. If the blood pressure does start to go high, then we'll probably turn the drip down and give you some medicine that'll bring the blood pressure down. So we'll have those medicines available.
And how long does the effect last in terms of the success for you? Say we're talking about chronic depression.
Yeah, great question as well. So if it's a one-time drip, much like a lot of the other procedures that we do, it definitely varies from person to person. Doing the six drips over 2 to 3 weeks tends to have long-lasting effects until something else happens again. So, if everything's going okay with life, you might not need any more drips. If it's something where the situation that caused you to need the drip in the first place, like say you're depressed because you're taking care of, an ill family member, and that's really contributing to it, then you might potentially need them from time to time. As I mentioned before, pretty low potential for abuse or addiction or anything like that with ketamine. But if it's something where, the trauma happened a long time ago, or it's in the past, even if it just happened, even if it was just related to COVID, probably that six sessions over a couple of weeks, that's probably all you're going to need, and maybe even fewer than 6 sessions.
Great. Can you contrast the medications for depression versus like antidepressants compared to ketamine?
Yeah, so antidepressants generally are help to increase our serotonin levels. And as I think I maybe mentioned, interestingly enough, those drugs, when you compare them to placebo in trials, they actually really don't do much better than placebo, like maybe a teeny bit better. And they have all sorts of side effects. If anyone has ever taken antidepressants, like the SSRIs cause decreased energy, decreased libido. And as I was showing with those little receptors, I don't know if you remember the little diagram with like the little glutamine going through and it being being blocked on the other side. So the reason it's so much more effective than SSRIs is that it doesn't just work on the serotonin pathways. It also works on dopamine and other happy neurotransmitter pathways. And it's basically like increasing the amount that's getting through and decreasing the amount that's sending pain signals. So it's kind of upregulating the good neurotransmitters and downregulating the bad ones. I shouldn't say bad, because the ones that cause pain are helpful for sure, so that we can know that things are going on. But in terms of, addressing chronic pain and depression, that's kind of how it works.
It's a very helpful answer. Thank you. Could you speak to the order of treatments if someone were to come through Joy Wellness Partners? Someone asked, what's the best order of treatments? Stellate block and ketamine were kind of both discussed as synergistic.
Yeah, great question as well. So if it kind of depends what's going on for the person. So if someone's coming in and we have a few different scores that we can use that will look at a numerical value for your depression or your PTSD. And we can look at those scores, and that will give us some more information. If say your PTSD score is quite low, but your depression score is quite high, then I would say probably we should just start with the ketamine. I think if there's any element of PTSD, we should start with the stellate first. And we usually start with the right side first. And then if that is not effective, go to the left side. And then I would say with the vast majority of people, doing a stellate ganglion block and then doing the ketamine drips is just going to increase the effectiveness of the the treatment for depression or PTSD. So if you're coming in for a stellate for PTSD, adding the ketamine drip is just going to augment the effects.
Great. Thank you. That's very helpful. If someone is coming in for a treatment, would there be medications they would need to abstain from the day before or the day of the treatment or after?
Yeah, that's a good question as well. So I didn't mention this in the talk, but it is important that you have not eaten or drank anything right before the treatment. So ketamine in the amount that we're using, it shouldn't cause you to become unconscious or anything like that. However, because of that nausea that I talked about, and because like I mentioned, you're going to kind of just feel like you're floating in the air. There is a chance if you get nauseated and you vomited a little bit and you're just kind of lying there not worrying about things, that you could aspirate. Basically, you could choke on your food. And for that reason, we ask people to not eat or drink anything for a few hours before. Certainly anything that is going to, that could potentially upregulate your blood pressure, you wouldn't want to be doing. I guess I mean things like I wouldn't want people to be drinking extra caffeine or anything that's going to sort of amp them up. And another thing on that note is, however you go into the drip, that's kind of going to be that will determine what your experience will be like. And so what I mean is, if you've had a super stressful day and you've gotten in traffic and you've gotten in a fight with your work colleagues and you found out that your dog needs to have a procedure and you're stressed about money, if you show up at Joy Wellness Partners feeling super stressed, we're going to do everything we can to try and get you to your nervous system to calm down and to kind of think about positive things. Because when you go under with the ketamine drip, whatever is on your mind beforehand is going to stick with you. So you want to really have some visualization before. And if you're going to be having a drip, say tomorrow, or even later in the day, it would be a great opportunity to do some journaling about intentioning. So you can write down intentions, or even talk to a friend. If you haven't done it, we will most certainly go over this stuff with you when you come in. But have an intention of what you want to get out of the strip. Maybe it's that you want to improve your depression, but many people, I didn't talk about this, many people use things like stellates and ketamine as well for performance enhancement and for the ability to open their mind and heart, even if they're not suffering from depression and anxiety. So the more that you can set an intention, the more that it's going to work. We really, I think, are probably only scratching the surface of understanding the human brain. But I think we can all agree that it's very powerful, and intentions really do make a difference with things.
That's great. That's great advice. And yes, at the clinic, we're going to have some supportive handouts for, aftercare, as well as some consultation before any individual comes to do an IV with ketamine with the providers. So that's great. There was another question asked about prompting or cueing if there's talking or breakthroughs. Do you know how to answer that? We're kind of, talked about that.
Yeah, that's a great question. So sort of as Carol was just mentioning, if you have a therapist already that you're working with and they either have experience with ketamine or open to the idea of seeing you while you're getting ketamine drips, that can be extremely helpful. And in terms of like the experience that people have, some people don't say anything and just lie there during the ketamine drip. And other people are really talkative, and sometimes things will come up. So because it's sort of removing the boundaries that we have, we build up all sorts of boundaries throughout our lifetime because of, the times that we were told no, or the times that we were hurt, or the times that we saw something that was scary. And ketamine kind of helps us to remove those boundaries. And so you might be able to start processing things that maybe you didn't even know were there to process. And that can be uncomfortable for sure if that comes up for you, if you have a memory that comes up that you didn't realize was there. And so we will always have someone sitting with you no matter what. If you do have a pretty significant history of trauma, though, we will make sure that someone is sitting with you who is trained to navigate whatever comes up. I'm not a psychiatrist, so I don't have the tools to navigate, pretty significant traumatic experiences coming up under a ketamine drip, but there are plenty of amazing therapists that are trained in this and can really help you to release that trauma, which is super powerful.
That's awesome. Yeah. And we're working on getting some direct referrals as well as some Zoom therapists to be available during the time that individuals may request that as an additional option for them. Thanks. I had one question from someone who came in a little late. They wanted to know who this beautiful lady is presenting.
So my name is Allison Mulcahy, and I am fortunate enough to be working with Carol and the rest of the team at Joy Wellness Partners. And my background is emergency medicine. I'm a board certified emergency medicine doctor, and I've been working in the emergency departments from giant tertiary care hospitals to, small remote clinics internationally for the past 15 years or so. And I've recently transitioned into regenerative and integrative and functional medicine over the last few years, and full-time over the last year.
Thank you so much. We're so honored to have you and to hear all this knowledge that you made so eloquently explained. I definitely have so many more notes taken and knowledge learned, and so I'm sure everyone else does. There's definitely a lot of interest in the chat as well, and I'm excited to see this program unfold, as I'm sure everyone will have questions about the logistics of booking. Please send your questions over to carol@joywellnesspartners.com. The first ketamine day we will be offering is actually this month in March on the 23rd. And most of the ketamine days we're going to be doing will be on Tuesdays, Wednesdays, or Thursdays. So please contact the front desk or contact me by email, and we can help with navigating your first appointments if anyone's interested. Thanks everyone very much, and have a wonderful rest of your week. Yeah.